Welcome. As you are coming in, you'll notice on the screen a fictional menu. Welcome to the Nourish Cafe, this make-believe place. If you don't mind just taking a look and seeing what you would like to order for lunch today, we have 5 delicious options, and we'll open up a poll shortly for you to put in your selection. We'll just wait about another minute to have people roll in and check out the menu, and then we'll get started. So you should see a poll that's now come up. If it's over your screen, it looks like you can drag it around a bit if you still want to read some of the description and take a look at the menu as it's presented. But just give us a sense of what you'd like to order for lunch. Unfortunately, we don't have the budget or logistics to actually send it to you, but you can imagine for yourself. We'll keep that poll open just for a second longer. Getting some great orders in. A lot of people have the same palette that I do, I can see. All right, hopefully everyone had a chance to put in their order. We are going to come back to that shortly. So it was all for a reason, I assure you. Welcome to our webinar on choice architecture. Specifically, we are calling it, if I click properly here, Nudging Toward Planetary Health. And so today we are joined by 2 incredible presenters. I'll share their bios with you now. Dr. Sadaf Molleai is the Errol Chair in the Business of Food and an assistant professor at the School of Hospitality, Food, and Tourism Management at the Gordon S. Lang School of Business and Economics. She holds an adjunct assistant professor position in the School of Environment, Enterprise, and Development at the University of Waterloo. And she holds a PhD and Master's in Sustainability Management from the University of Waterloo and an MBA in Marketing, where her research focused on food businesses. She also has over 6 years of managerial experience in the food service industry, and her research focuses on promoting sustainable food systems, with a particular emphasis on sustainable eating behaviors. Annie Marquez is a registered dietitian who graduated in 2008 and has been the coordinator of food services at the Siège Centre-Sud de l'Art de Montréal in Quebec since 2021. Previously, as the manager of the Harmonized Menu and the CS's informatics system, she joined Nourish's anchor cohorts from 2016 to 2024, and her studies in sustainable development and nutrition emphasize the importance of eco-friendly and healthy food choices. With Nourish, she created the Sustainable Menu Guide, we're all a big fan, and the Hôpital Solidaire program, which provides free meals to outpatients at hospitals. In 2024, she completed her master's degree, demonstrating the positive impact of that program on food insecure patients, and she now helps other institutions make their menus more sustainable. So today we're going to spend an hour together, beginning with a brief introduction to Nourish and to planetary health and food, and then I'm going to pass it over to our co-presenters to share about choice architecture and how this applies in a hospital setting. In the latter half, you'll have an opportunity to get into breakout groups and workshop some real life challenges, and then we'll come back together as a group to put it all together and have a bit of a Q&A. So just some usual housekeeping notes. To my dog, please don't bark as I'm speaking. To everyone else, we're recording the session. So we are going to email out the link to the recording if you want to share that around. We'll do that as quick as we can. But you're lucky to be joining us live because we got your input on that menu. And if you have any questions throughout, feel free to put them in the chat. We can definitely interact with one another, and we can use those questions at the end if possible at the Q&A period. And for right now, if you could introduce yourself in the chat, we'd love to see your name, role, and organization. So Nourish is a national nonprofit that supports healthcare leaders who are innovating right at this intersection of food and planetary health. And planetary health is just a shorthand for the health of people and planet, which are completely interdependent on one another. As our executive director, Jen, says, we are caught in this infinity loop where we support health systems to make changes to create a better food system, which then in turn supports a better health system, and it all really helps itself. But let me give you a sense as to why we do this. So inspired by the simplicity of Michael Pollan's philosophy on food, where he just says, eat food, not too much, mostly plants, I wanted to put together 3 simple big truths about food and planetary health. So the first is, unfortunate but true, we are experiencing human-driven climate chaos, and this graphic does depress me a little bit, so we won't dwell on it too much, but the next truth is, food systems are a big part of the equation. 1/3 of greenhouse gas emissions globally come from our food systems, and there is a wide range of the level to which different foods affect emissions. But the long and short of it is we do need a fast and effective shift to diets that emphasize climate-friendly foods and reduce our reliance on climate-intense foods. And then lastly, healthcare has a huge opportunity here. In Canada, you've probably heard this stat before, we spend $4 billion a year on feeding people in hospitals. We can leverage that huge spend that's going to happen anyway, that also translates to massive amounts of food getting planned, getting purchased, getting eaten, to decrease the negative impact that food systems are having on the planet. It is not only a great example of climate action, it also promotes public health too. You can see that the planetary health diet here is almost identical to Canada's food guide. Every day, what's on that patient tray or what's served in the staff cafeteria is seen by the eater as a medical recommendation of an example of what food they should be eating to promote health. And those patterns trickle back to home and back to the community. So many experts, including Dr. Walter Willett of Harvard, emphasize that a plant-based diet is nutritionally adequate, and when it's consumed in a varied way, provides all the essential things that we need. He also notes that plant proteins offer additional health benefits like fiber and phytonutrients, and they support disease prevention. Plant-forward eating is often more budget-friendly, and that's a very welcome thing at times when food service leaders feel the squeeze of budgetary constraints and the need to find strategies to alleviate that. When it's planned well, plant-forward meals result in high patient satisfaction, and even if food waste remained the same, that waste would have less cost and less climate impact, so that's great. I'd love to call it a triple win, but I think it's actually more than that. Economically speaking, shifting to plant-based diets could reduce that hidden health, environmental, and poverty-related cost that's estimated at $15 trillion annually. And shifting to plant-forward diets yields a higher emission reduction, like a ROI, outperforming other sectors in climate impact per dollar invested. And so for all of those reasons and so many more, our team hosts a community of practice that is now 36 hospitals strong and growing almost every day, of food service leaders and healthcare innovators who want to advance low carbon planetary health menus at their organizations. If you're not already a part of it, we'd love to chat with you more about you joining. So stay tuned till the end when we'll have our contact information up. And with that, I'm going to introduce Dr. Sadaf to tell us more about choice architecture.
Thank you so much. Hello, everyone, and thank you for joining us. And thank you, Amy, for the introduction. So as we know, the aim of today's webinar is to talk about how choice architecture and how nudging can help create a shift in food choices in the healthcare system. And in this first part of the webinar, we want to talk about what exactly is choice architecture and what exactly is nudging, and then talk about how it has been used to shift food choices. So I want you to think about the people that are consuming the food at a healthcare system. We've got the patients, the workers, the visitors, other groups of people. And then, so that's the who. And then what are we hoping they would choose as their food? And it's a sustainable, healthy, nutritious food. And it's all along the lines of making sure that it's sustainable, whether it's the Planetary Health plate or the plate from Canada's Food Guide. It's all about having that balance and making sure that the food is produced sustainably and has low environmental impact. So we know the who and we know what we're trying to achieve, but the big question is how are we going to achieve that goal? And today we're going to be focusing on that. So we have different tools to create that shift towards sustainable, healthy food. For example, you've got vending machines. What type of food is offered in the vending machines? Where are they located? Thinking about the cafeteria, what type of food is offered? What are the prices? How are they displayed? The menu, the options there, the design on the menu, even thinking about the floor plan of where the food outlets are located, what type of food is offered. There are all these different tools that have been previously used to help create that shift. For example, if you don't want people to have junk food, then maybe not having that option available is going to stop them from ordering there because the food is not there. Or, for example, thinking about taxes. If there is a tax on sugar sweetened beverages, then sometimes people are not able to afford it, or it's going to be they won't be able to really justify the price increase, so they're not going to drink that. And things like taxes, regulations, limiting options, these are some of the very common ways of trying to create that behavior shift, and they have been impactful. But one thing that's sort of common in all of these strategies is that you are taking away some of the choices. And there's an alternative approach to creating that shift while not really limiting any options. And that gets us to choice architecture. So, choice architecture is intervening or altering the environment or aspects of the environment, for example, the menu, within which people make their choices. And in this case, we want to focus on their food choices, and that place environment is the healthcare system. So you're altering or making small modification so that you can create that behavioral shift that you want to see. So what's happening is that you're basically nudging people or giving them a small push towards that shift that you want to see. So nudges are defined as any aspect of the choice architecture that alters people's behavior in a predictable way without forbidding any options or significantly changing their economic incentive. To count as a mere nudge, the intervention must be easy and cheap to avoid. And there are a few points here which are important when you're thinking about nudging and creating a nudge, is that most importantly, you are not taking away any of the options. And you are not imposing any additional constraints, or there is no requirement for additional effort, whether it's time or actual effort or paying much. What you're trying to do is you're just trying to facilitate creating that shift. And using nudges have been proven to be impactful for creating a shift towards sustainable diets, but their effectiveness really depends on how they're designed and also how they're implemented. So, I wanted to talk about some specific nudges for healthy eating and give you some examples. Just wanted to say that this is a very broad topic and there is so much that we can uncover and discuss. And just for the purpose of time, I will briefly talk about these different nudges and give you a few examples, but I'd be happy to answer any questions at the end or even after the workshop if you, my contact information will be there. So you could definitely ask me any questions if you want. So, the first category of nudges for healthy eating or healthy and sustainable eating is provision of information. And this is a very commonly used method. And it could be, for example, labeling. You can see the Nutri score on the packaged food here, saying that this food is healthy, where it lands on being healthy. Or, for example, providing calorie information on the menu or any type of label. So, it's a very commonly used approach. The second type of nudges are use of salience and social norms. So it's basically making the health aspect or the sustainability aspect of the food more salient. And that could be priming, point of purchase reminders, It could be, for example, through signage and colors and display and how you present it, creating a contrast on the menu. And then the other one is using social norms. You can see here we have an example that says already 53% of the restaurant visitors choose food as dessert. So people want to fit in. And if you see that something is a social norm, you probably research shows and experiment shows that people will tend to choose what everybody else is doing. So if you create that social norm feeling, you can create that shift. The third category of nudges are making healthier options the default choice. And that this could be, for example, the side dish that comes with the main dish. So, for example, instead of fries, the default choice would be the salad. Or if you're thinking about a bundle of, for example, a burger, fries, and a Coke, it would come with a Diet Coke. And again, research shows that people will not go in and change. A lot of people will not go in and change the default and will just go with whatever is offered to them. Or, for example, on the menu, maybe you want to uh, keep the default standard menu as the plant-based option, and then everything else is not the default option. And what is important to consider here is, again, you're not taking away the choice. It's still there, but you're presenting it in another way. And the fourth one is altering the location, presentation, and composition. And that's really important, for example, in terms of positionality. If something is at eyesight, then the likelihood of somebody choosing it is higher. So thinking about your vending machines, which products do you put in the eyesight, or even in cafeterias? What do people see and what is at the back? What people see, they're probably going to choose that. Thinking about portion sizes, which actually really helps with waste management control, and thinking about having more options and more availability. And then the last group of nudges is using incentives and pre-commitment to alter food choices. And that's also proven, it's one of those nudges that's not necessarily used a lot, but it has a lot of impact. So, for example, if you buy the plant-based option, the more sustainable option, you will be able to participate in a lottery, or you will get a credit and then you can use that credit towards something else. And then the pre-commitment is thinking about ordering your food ahead of time in a non-hungry state, when you're not exposed to the smell, the peeling smell, and the appearance of the food. And people make healthier, more sustainable choices in that state. So, wanted to also show you some specific examples from some of the studies that have been done. So, this was a study that played around with the menu. And what they did is that they wanted to nudge plant-based meals. And what they did is that they had their original menu, which had the appetizer, three main courses, and then the dessert. And in the main courses, there were two plant-based option, one plant-based option, two animal-based options. And then for the intervention menu, what they did is they had the same appetizer, the same dessert, but instead of three main courses, they called their main course dish of the day, and it was the eggplant lasagna, which was the plant-based option. So if we think back to these the nudges that we talked about, they used the default option. So the default is the eggplant lasagna. And you can see at the bottom, it says if you want something else, you can ask the staff. So the options are still there, but they're not the default option and they're not displayed. And the results actually show that the people that had to choose from the intervention menu, 85% of them went with the dish of the day. Whereas the ones that were in the control group and had the three options listed on the menu, only 9% of them chose the eggplant lasagna. And when they asked about their overall liking, there was no difference. So people were not disappointed in choosing the dish of the day. They liked it. And the way it was presented, it increased the likelihood of it being chosen. And the other interesting study that I wanted to talk about here is that there was a study done in three hospital cafeterias in Vancouver, and they wanted to test two different types of interventions, salience and availability, to promote sustainable and healthy food choices. And in their first study, their intervention was salient. And what they did is that they had colorful signage around the foods that they wanted to highlight, which were the sustainable options. And they also removed the physical display of the unsustainable options. And by doing so, the order for sustainable options actually increased. And it was more of a short-term increase, and the effect faded after the intervention was done. It was a 7-week intervention. uh, but still, during that time, the orders increased. And then for the other study, what they did is in the first location, they more sustainable options. They increased the number of sustainable food options. And then in another location, they decreased it. And by increasing availability, they had a 9% increase in sales of the sustainable and healthy food choices. And when they decreased availability, it was a 7% decrease. So just to wrap up this section, I just wanted to highlight some of the important learnings that we have from the literature. And it's that these nudges, availability, labeling, salience, availability, these all work and they help create that shift towards sustainable, healthy food choices. What's important is that for some of them, the impact is actually temporary or short term, which means sometimes you need to have a combination of different strategies and different interventions. And sometimes you need more of a multi-phase approach so that you can enhance the effectiveness. Another important thing is that consumers are different. And we don't have a one size fits all approach intervention that could resonate with everyone. For example, if you're putting the calorie information on the menu, it only works if the person cares about their calorie intake. If they don't, it's not going to be impactful. And that's again why it's important to have a combination of different strategies in order to create that shift, take a multi phase approach. And another thing that's very important is that without supporting policies, such as pricing policies and education or financial support, people might just revert back to their habits or they might compensate by eating differently elsewhere. So it's important to have that support, combine different interventions, and also be transparent about what you're trying to achieve here. And you want to build trust and acceptance. And we want the consumers to be receptive for that behavioral intervention. And creating that trust really helps creating that impact. And that is all for me. That's my email again here. And if you had any questions, I'll be happy to answer at the end. And I'm going to hand it over to Annie now.
Thank you, Sadaf. So the big difference between what you just talked about, the intervention we can do is mostly like in the cafeteria. So for us at Sud Centre Sud, the challenge is to work with the patients who receive a tray. Maybe we have more power on over what they will choose because it's a computer program, that will let them know what they are eating. But the big challenge here is to make it that they like it and that it tastes good. So I'm gonna show you a bit what we did to put those more sustainable choices on our menu. So just in order to begin, just so you know that our menu is used in 2 hospitals. Well, one now, one in June, so it's coming to the second. 15 long-term care patients center and one rehabilitation center. So we have a lot of comments that comes from those patients when there's one recipe they don't like. So we don't have the choice to make sure they like it. So we began that menu in 2016. So now we have really a good way of treating the comments we receive from each patient. At first, we had to write guidelines to create the harmonized menu. So in our guidelines, for me, it was really important to have the principle of sustainable development in all steps of creating our menu, and that from the beginning. So I did that before the sustainable menu guide with Nourish. So it was a bit of the base of the work I did with Nourish. We at first we need to know which each type of patients, what are their needs, what will be the nutritional values we will work to create the menu, and what will be the content of the tray for each meal. And we have financial limits, production limits. We have different kind of kitchens. So this is really important to be considered also, and the satisfaction. So for creating a sustainable menu, if you go to the guide, you will have each step, but it's really important that we fixed criteria for each type of food. We also, for our menu, decide which quantity of each type of protein per week, per day, because as you know, we cannot just put a vegetarian menu if you want people to like it and to be happy with our menu. So, but we also try to fix a limit for the meat or for the red meat. We also decide some small ingredient list that would make a difference for us, like no palm oil, no trans fat. Also, we try within our contract that we have to choose more local food, and what are the plant-based choices we have, because sometimes it's not easy to really have what we want for as ingredients, but we try to work with the company also to have more choices. And if possible, organic and fair trade, but it's really hard for us to pay that price. Sometimes it's the financial limits who limits us. We have also think the menu in a cycle to prevent food waste, but there's a lot of work to do on that even now, because it's hard to make sure that all our kitchen reduce our food waste. And we meet and work with local suppliers and producers, as I say, to make sure we have the ingredients or the food that would correspond would really respond to the needs of the patient, and to innovation also in reducing the meat on the menu. So this is just a small picture for you to see the sustainable menu guide. When we create the menu, the guide is written so each chapter is the same way that we create the menu. So at first we choose the protein, and then we put the starch and the vegetable around it, and then we complete the tray. So you have all the criteria for each type of food that you can add if you want to choose which sustainable small step you will make. There's a lot of steps to do in that guide, so you have to do it one at a time. So for our experience, just before I show you all the recipe we created, mostly it's with the elderly patients we have to work, because they're the more difficult to make them like the plant-based recipe. So what we learn with them is never put the word vegetarian in the name of the recipe they will receive, except for example the pizza. Vegetarian pizza. Like, this isn't a common name, so they will like it. But if it's written in you have less chance they will like it. We also transform the vegetarian protein to hide it, to make it look like something they know, to mix them with meat for better appreciation. Sorry. We also tell them, because at first they tell us, well, it's because it's less expensive that you put plant-based protein on the menu. And no, we have to explain that really the priority is to reduce our environmental impact in our menu. Also, we can put, since it's a computer program that puts the food on their menu, we can put the more sustainable choice in the first position, like it will appear as a priority on the menus. We also have put the symbol on the menu. I will show you just after, so they can see which are more sustainable. And we try to make a tasting panel with each new recipe, so we make sure they like it and they're not going to garbage. So this is an example of the symbol we put on our menu. So maybe to attract the eye on the vegetarian choices with a small V green. I know it's small, but this was just to let you know. Also, the blue is for the local Quebec choices. And the stars, well, it's just to show them that we put what they like first on the menu also. So I'm going to present you a bit of pictures. We're not professional photographers, and I know it's not the, the sustainable plate that you see from the presentation, but it's just the recipe. What's important there? So we have the vegetable lasagna. It's a classic. This is really loved by everyone, so it's easy. The garden chili, where we say garden chili and not vegetarian chili, as you see here, and it's with PVT in French, but VPT. Anyway, sorry for it's the protein vegetarian that we put there. So it looks a bit like meat, and we try to make it look also taste also like a chili with meat. Legumes loaf. It's with legumes that we blend and we make a loaf. Usually, when you put cheese on top, it's even more appreciated. So that's a bit of a trick we do sometimes with the vegetarian meal. Pasta primavera is we realize that if we put the vegetable inside the recipe, it will be more liked and less throw to the garbage the vegetable if it's inside the recipe instead of on the side, because we don't do like a recipe with the vegetables. So this is also something we do. And lentil in a bun, well, it's a mix of lentil that tastes a bit like I don't know if you know gumbo bread, but it's like a vegetarian version. We try also to reinvent some classics like the carbonara pasta we put with faux chicken. So it's one of we don't have a lot of of um, ultra processed food on our menu, but this is one because it's easy, it tastes good. So we put faux chicken in there. The beans with tomatoes, this is a classic, but with no pork. Vegetarian pizza, easy, creamy Alfredo style sauce. Well, this is a trick we do is to put white beans blended in the sauce so they don't see it, and we reach the protein we need to give them. The mushroom pie also, it's tofu blended with lentil and mushroom, so it looks a bit like meat, but it's full vegetarian. And rich cheese sauce, well, it's just that the carrots are in there, and we make sure also to reach the protein level we need. So this is examples of less meat and better seafood. Well, we put some plant-based protein in there. So for tuna, we put rice in the cake. So we make a blend of tuna and rice. And this is a sustainable fisheries tuna. Meatloaf, we put the TVP in there, a bit of to reduce the meat also. Meatballs with tofu. So we buy the minced meat with tofu already inside of it. Meatloaf with quinoa, another kind of protein, plant-based protein we put in there. And the seafood, well, when we create a bit of we reduce the amount of meat, we save money, and we can add like Nordic shrimp. That is a lot expensive, but we can do it because there's less meat on the menu. So that were our examples. We did a bit of our work in Arceus, and people like it. So this is the important thing. Thank you.
Thank you so much to both of you. we're now going to move into breakout rooms. So in the promotion of this webinar, we had asked you to bring a challenge or a goal that you have for your menu that you'd like to workshop with the group. And based on registration, we thought we might need about 3 rooms that are working on patient meals. And we've also set a specific room for folks who want to talk about cafeteria meals. And then we'd like to test if there was anyone who's most comfortable in French, that we could also have a room there. So we'll just sort of let you to the wild and you can choose which one you want. And we hope it's somewhat evenly distributed. So certainly if you notice one's getting big, go to a smaller one. We're going to spend 10 minutes in there. And your assignment is to talk about what menu change you'd like to make and what behavioral techniques you would need to use to nudge people in the right direction. If no one in your group at all has an idea, you're welcome to use our original menu from the beginning to see how could that be improved. And we'll call you back shortly. I'll pop into some of the rooms and see if you need any guidance. And just assign one person in your group to do a really quick, like 2-sentence share back. We will see you soon.
Amy, do you have a preference for where you want us to go?
If at least you and Roya want to kind of split into 2 different rooms.
Okay.
All right, I see people trickling back in. So we had to update our menu and we've got a new lunch available. If you wouldn't mind taking a look at this new updated lunch menu, we'll just start a poll in a moment to see what your order will be. Very similar to before, it is in fact a make-believe cafe, but we'd love to hear what you want for lunch. So take a look, and when the poll begins, we will take your order. Oh, seeing some orders come in already. I'm just not sure if everyone's come back from the breakout room, so we'll keep it up a minute longer. Already seeing some really interesting results, I think. Definitely validating some of the things that we've learned today. Okay, maybe just looking for a thumbs up from Nairi. Is everyone back from the breakout rooms? Are we okay to, or should we keep the menu a bit longer?
Everyone's back.
Okay, wonderful. Okay, so it looks like we've got your orders for lunch, and I'm just going to pass it over to Sadaf to talk about some of the changes that we made.
Great, thank you. So as you notice, we had a menu at the beginning, and this is sort of a revised version of the same menu. And we created some changes, and I wanted to briefly go over some of the changes that we made and see if it changed the orders that we got. So, I don't know if you remember the first menu, but what we've done is that we have actually replaced the photo of the cheeseburger with the photo of the salmon, which is the more environmentally friendly option. Another change that we made is that we highlighted the regional ingredients and also brought the plant-based option to the top, so making it priming people and then making it also more salient. Another thing that was done is the miso glazed salmon has the label of today only, and it's also highlighted with a color. So that creates that contrast that we talked about. So it will get attention from the consumers, and then the today only adds some sort of a specialty to it. Another change that we made is that we renamed the grilled cheese sandwich, and it's called now it's called instead of meat free, it's brie grilled cheese. So the renaming a plant-based option. Another thing is that we have added a few more the tempeh pizza, which is additional plant-based option. And that works with availability. So now there are more options, plant-based options to choose from. Another change was that the beef burger is actually now lower on the menu instead of it being at the top and having an image. And also the price has been increased a bit, and it's not it's not it's not too much higher. That's not affordable or it's extremely higher, but just a bit of a change to create that financial incentive. And then finally, we've got the chef special spinach salad again, to make it more exciting, and making it the chef's special brings that contrast and then brings salience to it. And I'm just going to hand it over back to Amy to maybe go over the results that we got from the ordering.
Yeah. So I'm excited to share a few results from just crunching those numbers. We updated the lunch menu slightly, and while the average calories went from about 800 to about 600, and the average spend was kind of similar, the total greenhouse gas emissions associated with our group lunch went down by 49 kilograms of carbon dioxide equivalents, or an average of 2 kilograms per person, which is actually very significant. When the recommendation is to try to keep your personal GHGs for the day under 2, or sorry, for a meal for 2, we went from being way above the recommendation to actually meeting it and being slightly below it, a 64% reduction in the climate impact of our lunch eaten today. So that's amazing. Congratulations, everyone. Congratulations to Choice Architecture. And we might just ask for some of the insights from your breakout rooms if one person from each wants to share a sentence or two. Starting with patient meals number 1.
I can share. Our group talked a little bit about using the icons and more fun names, and really highlighting the vegetarian options higher on the menus as a way to improve planetary health options and nudge patients that way.
That's great. And anyone from patient room 2?
I guess I'll say something. I posed a question for the group because we are wanting to put on a white bean curry onto our menu, but we've had some issues with the word curry kind of making people not select the item. I mean, there are some people that enjoy curry, but some that do not. So we're hoping to, are there any other words or names that we could name the item? So the team had some great suggestions for me. And also, in our long-term care, sometimes plant-based is not as, like, some patients are just want their meat, I guess. So there was a suggestion to talk with the patients or the client relations team to see if there is, just to promote it, the protein content, things like that. So it was a good discussion. Thank you to everybody that was in that room.
Thanks, Donna. And from room 3.
I don't know if there was a room 3.
Oh, I thought there were 3 patient meals rooms, but maybe that's not the
But I
case.
think people might have just chosen the 2. But we did have a retail cafeteria one. Eric should
Sure,
probably.
yeah.
You say Eric should talk? Eric talked enough during the breakout, I think. We unfortunately, all the retail people were from the same organization. So I got the chance to interact with Jennifer and Mary, and they had some great questions about some of the unique challenges in the retail area, and especially as a fundraising partner to the hospital, where we're responsible to generate donation as well. And people have more agency. They can choose not to eat with us at all, as opposed to a patient who has to pick something. And some of the strategies we've tried that have worked and some that haven't worked, but it was nice to share, some of the progress we've made, because we've really put an investment in trying to get the menus healthier and more climate friendly kind of over the last 2 years.
That's great. Thank you. And good to finally meet you face to face. So now I'm going to pass it over to Sadaf. With our final time, we're going to hold a Q&A. I'm sure we've got some questions. Maybe you can put some questions in the chat, and we'll wrap up right at the hour.
Amazing, thank you. So I was thinking that if any of the participants, they might have a question, this would be the good time to ask, or if you want to put it in the chat from either me, Annie, or anybody else, somebody that you interacted in the breakout rooms. And I'll just give it a few seconds to see if anybody has any questions, because I do have my questions for Annie, but I want to give this, Jennifer, I see your hand is not a virtual hand, but your actual hand. So
I can
go ahead.
never find it fast enough. I'm curious, Sadaf, in your research between the nudges of the health and sustainability benefits, and sometimes they're seen as like in conflict, or does one stand out over the other? Is it powerful to use them both at the same time, or do one to lead to the next? I'm just curious I know it's a big question, but.
Yeah, so that's a great question. That's a big question. So a lot of the research tends to focus on the health part of it and thinking about the nutrients. And then if something is about sustainability, it's mostly focused on the climate change piece of it and the greenhouse gas emission. So it makes it a bit easier to create a nudge or create a goal that you want to achieve. And then sometimes being healthy is not the same as being sustainable, and vice versa. So I always refer back to the FAO's definition for sustainable food and sustainable diet, which includes health and includes nutritional aspects and creating that balance. And there's still, in terms of research, there's still a long way to go to make that comparison of, okay, does nudging for healthy food has the same result for sustainable food? But the general point sort of finding so far is that people care more about their health. So nudges toward health is more acceptable. And not a lot of people care about sustainability or environmental impact if you're thinking about the environmental aspect of sustainability. So it's about maybe using that health framing, but then you're also nudging towards that nutrition, that sustainable balanced meal. So trying to play with the nudging or the approach that you're taking. I hope that answers the question.
Yes, perfect. Thanks. Could be its own whole webinar. Maybe our next one. So.
Yes. Anybody else? Does anybody have any questions?
I was going to say, looking at the time, it might be great to take questions after via email, or if you go to the Nourish website, which I can put the contact information up for. Just a big thank you to our presenters today and to everyone for participating, for coming to our Pretend Cafe. I think the results were really impressive. And if you are interested in joining our community, you can go to our website and learn more or reach out to us as well if you have any questions. And we'd love to welcome you into the movement, work more with you, and we're excited for the future of food. So thanks, everyone.